We can probably get going now. It's 11:30. I welcome everybody back, and we'll start today, as I just mentioned, with Dr. Pryor, president of Essentia Health East Market. He'll be followed by Dr. Van Dillen, chief medical officer at St. Luke's, and then Amy Westbrook, the St. Louis County Public Health Division director, who has graciously agreed to join us this week. As a reminder, Drs. Prabhu and Thompson are infectious disease experts, are here to answer your questions as well. You can use the raise your hand function in Zoom or the Q&A feature at the bottom of your screen to ask those questions. And we'll aim to wrap things up around 12:15, leaving a few minutes at the end for closing thoughts. And before I turn things over to Dr. Pryor, and FYI that this will be our final scheduled weekly press conference. If and when developments warrant in the future, we certainly can reconvene. And these briefings have been such a great tool for us to share information and communicate during this pandemic. And so thank you to all of you who attend and help keep our communities informed. And I'd also like to thank the 4 doctors who have been with us every week for these past 2 months. I understand that your schedules are insanely busy, and so we really appreciate you making time for these as well. And with that, Dr. Pryor.
Thank you very much. I'm John Pryor, president of the Essentia East Market. Before I start, I'd like to point out that I'm wearing a green tie today. It's hard to see, there's a little blue in there too, but it's green. And I like to point out there's green in the Essentia logo. And this is important. You're going to see my colleagues also have something green on them, because this is in honor of National Mental Health Awareness Month. And I think most of you know, but if not, mental health issues affects 20% of our population. I suspect that all of you, all of the readers and the people watching this on TV and all the reporters and stuff know that mental health affects about 20% of the public. Everyone probably knows somebody who has mental health issues or may have it themselves. We want to destigmatize it. We want to put more attention on it and realize that this is a health issue that's got a lot of downstream effects. And not only does it create pain for people, but it affects their ability to work and function oftentimes. And so we want to pay attention to it and make it more aware, so that we're wearing green in honor of this month. So with that, I'll move on to more COVID-related things. I want to briefly talk about Waltz's announcement last night that he's loosening his stay-at-home order. This means certain businesses and retail stores are going to be reopening. It doesn't mean, however, that we can let our guard down and return to normal. So I know my colleagues here would urge everyone to continue using their best judgment. Stay at home if you can. When that's not possible and you have to venture out, practice social distancing, wearing a mask, and all those things that we talked about over the past couple of months, like, when you sneeze, sneezing your elbow, wash your hands a lot. All of these things still are in play here. We're thankful for the sacrifices you've made these past 2 months, sacrifices that have allowed us to better prepare for an influx of COVID-19 cases by building a supply of PPE and increasing our hospital and ICU bed capacity. But this public health crisis isn't over, so again, please continue to exercise caution. At Essentia, earlier this week, we hit a milestone that I'd like to share with you that we could not be more proud of. We have conducted more than 100,000 virtual visits since COVID-19 began. To put that in perspective for you, in the middle of March, we have conducted 0 virtual visits. As of yesterday, the 1,200 physicians and advanced practice providers in 60 specialties that offer virtual visits for our patients had conducted more than 102,000 of these appointments. That's more than 100,000 times patients did not have to leave their homes to receive excellent care during the COVID-19 crisis. With that said, there are some important visits that simply cannot be conducted from home. These include immunizations, eye appointments, mammograms, just to name a few. Our care teams have been working diligently to make sure that our own checklists for returning to face-to-face clinical care align with the guidelines of the CDC. Departments that begin offering appointments face-to-face on a limited basis will use these checklists to make sure they're abiding by the strictest recommendations for disinfection, social distancing, and other measures. Our clinics are as safe as they can be for you and your employees. In fact, I said last time we met, it's probably safer than most of the places you go. I remain convinced by that statement. We also could not be more pleased about resuming elective surgeries and procedures for our patients who have been waiting for this. While elective surgeries and procedures are restarting in our facilities, we're approaching this carefully and slowly to protect our communities, patients, and staff, to conserve PPE, and to ensure available hospital beds for COVID-19 patients when the surge occurs. Yet, for many reasons, the hardships caused by this pandemic continue to grow across our nation and across our organization. Essentia Health is not alone in facing the pandemic's severe financial impacts while planning how to best care for patients in the upcoming months. Minnesota hospitals and health systems expect to lose almost $3 billion in the first 3 months responding to COVID-19. At Essentia, our operational losses due to pandemic-related declines in patient volumes in the last 2 months have been significant, and we have implemented many cost reduction measures to sustain our mission and the care we provide today and long into the future. We continue to evaluate ways that we can sustain our organization. What we want to stress, however, the very most right now is that our clinics and urgent care centers continue to serve people with medical needs. Our hospitals are open, and we are ready to care for anyone who needs emergency care or needs diagnostic testing like an X-ray or a procedure like a mammogram or surgery. If you have health issues, don't wait to be seen or cared for. Waiting can make matters worse, and sadly, we've seen this. Instead, know that we're here to provide the safe, quality care you have come to expect. Finally, from the bottom of my heart, I want to thank everyone who has been working so hard throughout this crisis to provide exceptional care for our patients. There are people who just do things on the QT without any warning and step up to take care of our patients and provide safe and wonderful care. There's many people who have been working 7 days a week to make this happen. It is an honor and a privilege to work alongside you. Thank you.
Thank you, Dr. Pryor. Dr. Van Dillen.
Thanks, Dr. Pryor. Thanks, Louis. I'd like to begin today also to discuss elective surgeries. This week, although we have been doing some more urgent procedures, we've started doing elective surgeries again, and it's the first time in well over a month. It's exciting that we're once again able to provide this important care for our patients. And also a bit different, as there's a new dynamic with all of the additional precautions that we are now taking, having to update even the basic workflows that we use in our procedural and surgical areas. We are intentionally at about 50% our usual capacity. While it would be great to be at full capacity, it's essential that we are methodical about this, that we follow the MDH guidelines and ensure that everyone, staff and patients, are safe. The extra precautions we are taking to maintain that safety include monitoring our PPE and critical medication so there's enough on hand so we can take care of our surgical patients and patients during a pandemic surge. We've been reviewing our surgery requests twice daily to assess capacity and prioritizing cases based on clinical need. We're confident that we'll be able to continue to provide the exceptional surgical and procedural care that our patients expect. At the same time, we'll continue to keep a close eye on the COVID-19 cases within our region, with the understanding that if procedures need to be modified or delayed, they will be. That said, we're fortunate that COVID-19 cases remain quite low in the Northland, and the hospitalized cases in this region are really low compared to elsewhere. We're not seeing a surge yet, and we thank everyone for helping to slow the spread. So I want to remind patients that it is safe at St. Luke's too, both our clinics and the hospital, for any and all of your healthcare needs. I want to reassure you that if you have a medical need, you should come in and get checked out. Don't wait. In an effort to ensure that patients get the care that they need, we've implemented robust safety measures. We've talked about these a lot over the past weeks, but it's worth a quick run through. Currently, only the patient is allowed in our buildings, unless the patient is underage or requires assistance with mobility or communication. We're striving to have every patient wait in their cars to be registered, and then go straight to an exam room upon entering a clinic. We are requiring everyone to wear masks, and we're doing extensive cleaning after every patient. And like always, we're adhering to strict hand hygiene measures. We take your trust seriously, and we are committed to providing you with the safest possible care. I'd like to also take a quick moment to highlight National Hospital Week. We are fortunate to live in a state where health is valued. National Hospital Week celebrates those working in hospitals, health systems, and really any person involved in keeping our communities healthy. This week is even more meaningful this year as we celebrate everyone doing amazing work navigating this pandemic. Everyone who chooses to work in healthcare, no matter their role, has answered a noble call. Here in our community, I'd personally like to thank those at St. Luke's, Essentia, our nursing homes, assisted living facilities, and other healthcare organizations for all the work you're doing for our community. I'd also like to take a moment to call attention to the reason I have a green pin on. It's to represent Mental Health Awareness Month, which is happening during May. I just didn't have a green tie like Dr. Pryor. We at St. Luke's, Essentia, and St. Louis County are members of the group Northland Healthy Minds. This group is a collaborative of businesses, organizations, and individuals working together to eliminate the stigma surrounding mental illness. To learn more about this great opportunity or the great support they offer, please visit northlandhealthyminds.org. Finally, I'd like to thank St. Louis County and their teams for their partnership with St. Luke's and Essentia during this pandemic. We truly appreciate all of their dedication and hard work. I'll now turn it over to St. Louis County Public Health Division Director, Amy Westbrook.
Thank you, Dr. Van Dillen. I wanted to just talk currently sort of what we're seeing in St. Louis County in terms of numbers and what, with expanded testing, what it looks like for the distribution of disease. It's been a couple weeks at least now that we have had the expanded criteria for testing to include anyone who's symptomatic with COVID-19 symptoms. So we have seen more people being tested. And with that, we were anticipating a dramatic spike in cases reported to the public health system. We continue to see cases reported. It's not as many as we initially had thought given the expanded testing. So that's a good thing. To us, that tells us that even though our health systems are testing more, we're not seeing as much disease in the communities, but we are seeing continual spread. So all of the counties in the Northeast, except for Cook County, those counties that border St. Louis, our big border up to Boundary Waters, have been seeing cases, and we continue to see cases reported from across our county in urban and rural settings and continue to spread. So we're seeing that, the geographic spread, and then we're also seeing the age range broaden pretty significantly. So we're no longer seeing it be reported just in healthcare workers or just in individuals who are residents of congregate care settings. So as Dr. Pryor mentioned, the Stay Safe order, I feel like we've been doing a good job with following the stay-at-home order, and it's really important to continue to follow the Stay Safe order now. So that's sort of what we're seeing in terms of distribution of disease. We're still, all of our deaths that have been reported in St. Louis County have been associated with congregate care settings. So we are working with the health systems across the county to really do some more intense outreach to specifically long-term care facilities. This is a priority across the state. About 80% of our deaths in Minnesota are within individuals or among individuals who are within long-term care settings. So as a public health system, we're really trying to do better assessment and outreach to long-term care facilities. Another priority for us in St. Louis County, as well as the statewide public health system, is with expanded testing. We want to also expand case investigation and contact tracing. We're working to build a statewide centralized system, but we also are working to build local capacity. So we're working within St. Louis County and across our bordering counties to build up that, that capacity to follow and to do the investigations of individuals who are reported as quickly as possible, reduce that time lag from reporting to follow-up, and then also in notifying individuals who may have been exposed to the confirmed cases. So that's an important disease prevention and controls strategy that we really want to beef up to in Minnesota. The governor's Stay Safe order, from a public health perspective, it makes a lot of sense to really follow that for individual health, for community health. So I want to encourage everyone to continue to wear masks if they're going out, to remember the physical distancing. The governor did open up to where we can gather intelligently, so still doing the physical distancing, but have smaller gatherings, less than 10 people, and staying close to home, especially individuals who are immunocompromised or older. We know that those groups of people are more at risk of complications with COVID-19. So it's important for all of us to protect individuals who are vulnerable, to protect our neighbors, to protect ourselves and our communities. So that's all I have.
Thank you, Amy. And now we will open it up for questions. I would ask that everybody not jump in all at once. We have a question from Leanne. A question for both hospitals. Do you think the governor's new order will create a surge? And if so, are you ready to handle it?
I guess I'll answer first. I think the surge was going to happen no matter what. The good news is the governor the governor's in a tough spot. He has to balance the health and safety of the community with the economic health of the community. And I think he's been very wise in listening to the experts, not going on gut feelings, and looking at the data. So I respect his decision. Will it move up the surge a little bit? Potentially. It's hard to say, but we were going to have a surge no matter what. I think that's what we need to know. And we're grateful that we've had this time to prepare better, make sure we have enough PPE, make sure everyone's trained and we know what we're going to do when it happens. So the most important part of this answer is, yes, we're prepared for the surge when it does occur.
Yeah, I would simply echo what Dr. Pryor said. We're very appreciative to the governor and again, believe he's approached this in a very deliberate and thoughtful way, taking really important advice from experts. It has bought us the time to prepare. We are prepared. There will be a surge. There are different models, as we heard last week, about what that surge may or may not look like. But I think we're in a far better position than we were. And in the end, even with the change or the new governor's order, it really is up to us throughout the community to continue to do the things that are most important. And that's, again, the hand hygiene, the social distancing, the things that we all can choose to do that will keep us and our neighbors safe as we continue to learn how to manage this disease going forward. We're going to be dealing with this for months, possibly years, and we've learned a lot. It's not time to give those new behaviors up.
A question from a viewer. Somebody asked about testing, and I think Amy alluded to the fact that it's been a couple weeks now since the state talked about ramping up that capacity for testing. I know the number 20,000 tests per day was really kind of an aspirational number, but we continue to hover right around 4,000 to 5,000. And I'm just wondering if you wanted to talk maybe why that is and what's it going to take for that number to go up.
This is
maybe the healthcare systems would want to answer that.
yeah, this is Dr. Prabhu. I mean, currently most of the testing is still based on people that have symptoms, and there's been recent sort of health department guidance about the most vulnerable in the long-term care settings, congregate settings, nursing homes, etc. So, if there is a case or so in a nursing home, there is a mandate to test not only those that are symptomatic, but the other people in that facility. So the rest of the residents, even healthcare workers, to try to mitigate any sort of expansion of people that do develop COVID-19.
I think also in regards to testing, there's still, so we do adhere to the guidance from the Minnesota Department of Health, so we are testing symptomatic patients. But what we see is that there still is a supply issue in regards to the number of analyzers, the allotment of the kits and the swabs in order to do high volume testing. And then I think the next question is really, if you're going to do testing of asymptomatic individuals, it's what's the next step? How do you track those individuals? How do you do contact tracing that then can be impactful? So I think it was an aspirational goal. I think on a state level, we're doing better than we were, but it will take some more work to reach the level of 20,000 a day.
This is Amy. I did want to also mention the interpretation of negative tests for asymptomatic individuals. That really is a point in time result. So most often these tests are PCR tests, and that is testing for the presence of the virus. And that will tell you if you're infected that day at that time. It won't tell you if you have the virus the next day. So people have to be just recognize that there are limitations to all testing. And so if there is an exposure, getting tested, if you're asymptomatic, tells you if that you're not infected at that moment, not, a week from then or even the next day.
Yeah, Dr. Prabhu, I just want to build on what Amy said. So as an example, if you have someone in your house that has COVID-19 and other people in the house don't have symptoms, just because if you get a test for COVID, that PCR test is negative, it doesn't mean you can leave quarantine earlier than the 14 days. And And it's the testing in the long-term care facilities, it's more what they call point prevalence. At that point in time, they just want to see who else is potentially positive, but it does not mean that we would skip the other measures in terms of home isolation, quarantine room, et cetera, that's occurring in a long-term care facility. And I want to just add, it's not just, I mean, St. Luke's and Essentia have been in contact with the health department. There's a testing command center sponsored Mayo Clinic, University of Minnesota. So if we say run short on our testing capacity, they would pick up the slack for us. The caveat being the turnaround time may not be as rapid because we both have internal testing capabilities. But if we send it out to our reference lab or the testing command center, they'll be a little slower in terms of turnaround time.
Thank you all. A question from Brett Scott. Brett asks, how many COVID-19 patients are hospitalized currently at Essentia and St. Luke's?
I can speak first to that.
Go ahead, Matt.
Oh, I'm sorry. Go ahead, Andrew.
I'm going to say very few. We've had very low activity recently at St. Luke's. So numbers are very low right now.
Jace, why don't you answer it for Essentia?
Yeah, Dr. Prabhu. So, I mean, I think, as Amy had mentioned, the number of cases, and I haven't seen the numbers in the last day or so, but the number of people that would be hospitalized are really reflective of how much activity there is in the community. So I know our testing rates in terms of positivity are, under 2% or so. So at the moment, we don't have this major surge of patients. We do have people, just like every other health system in Minnesota, but it's few.
A viewer question, could, with the stay-at-home order being lifted or loosened, could those restrictions come back at some point in the future if necessary?
Yes.
And I think Governor Walz had commented on that as well. If need to reinstitute that, he will.
Yeah, I think it's important that any restrictions or mitigation factors be driven by data. And I think so far the governor has been very wise to do that. So if we see a sudden surge of activity, I think we'll have to reevaluate as we go along what other mitigation strategies we might need to undertake, because this won't go away after the summer.
And this is why you can all help the governor and help prevent restrictions going back in place by, when you go outside, again, wearing masks, maintaining that social distancing, because if you get close to people, COVID-19 will spread faster, we'll get a bigger surge, and then restrictions will go back in place. So we all have a role in helping the governor in this.
Question from Andy at the News Tribune. Andy says, I'm hoping to hear a little bit more about how the elective surgeries have been going this week. I know you're starting slowly and not at full capacity, but where are both hospitals at more specifically in terms of that, and have either found any instances of COVID-19 in people who were tested prior to a surgery?
So I can speak for St. Luke's. We are running at about 50% capacity, as I had mentioned, and that's deliberate, and are prioritizing cases, again, based on clinical need. And we were charged by MDH to actually develop a very clearly defined process for starting to do elective procedures, meaning that we had to track our PPE and assure that we have enough, not just for the surgeries, but also for if a surge should happen. And that includes meds, that includes being able to maintain our staffing. So I would say the first week has gone well. It's not ever as busy as quickly as we would hope to be able to do it, but it's opening up, you know, an area that has been really mothballed to some extent for weeks. So it takes time to get staff back, to build capacity, but it's gone really well. We do utilize testing prior to surgery. That's been successful, and I'm not aware of any positive COVID tests that have delayed a surgery since we started this week.
I think at Essentia, it's gone very well. So we just started on Monday. We're doing the same thing as St. Luke's. We're following the MDH guidelines. This has been, we've had a oversight team that's been watching this and slowly ramping up. I would say, I don't know for sure, and Rajesh, you may, Dr. Prabhu, you may have more information, but I think we're probably closer to 60% capacity. So we've definitely increased and we'll continue to do that. We know our patients are very excited about it. These are people who have waited a while now, a couple months to have procedures done. And it's nice to know that, I think by all signs, they seem pleased to be able to come back and feel like they're in a safe environment and they can get their procedure done. To the best of my knowledge, I don't think we've, in the pre-op testing, and we test people 3 days before and then ask them to quarantine. In some cases where we can't do that, we'll do that PCR testing that day. To the best of my knowledge, I don't think we've discovered anybody with COVID-19. And Dr. Prabhu, I don't know if you have any other information on that.
Yeah, I'm aware, but I think the point is, just to re-emphasize what Amy said, it's just a testing point in time. So we do everything possible to make that that surgical procedure safe, both for the patient and the staff. And we still take the same measures, you know, before surgery and after surgery, just in case someone's in that quote incubation period, meaning maybe they caught it the day of surgery, but they won't develop symptoms 5 days later. So we still keep those safety measures in place.
Yeah, this is an opportunity to really emphasize that point. You know, there's been some studies that show somewhere between 40 to 50% of people with COVID-19 are asymptomatic. So when you go out in the community and you're hanging out with people who aren't coughing, no shortness of breath, they're afebrile, they could have COVID-19. So everyone needs to be aware of that. And we're treating everybody as if they do. And I think that that's what really creates that success in having an environment that's safe for you. It's just by just being careful and treating everyone as if they did have COVID-19, even though we know that most people don't.
And Dr. Prabhu, again, just to kind of piggytail on that, in terms of that's the reason for our outpatient visits, that we request everyone that comes in, either a visitor or a patient, to mask as well, because you could be in a state of that asymptomatic, or what they call pre-symptomatic period, meaning you don't have symptoms of COVID-19, but they can certainly develop, and you can transmit to someone else within, 2 to 3 days prior to even feeling ill.
I don't see any other hands up or notifications in the Q&A feature. So right now I will, I think Dr. Thompson has a couple closing remarks, and anybody else who's with us, if you want to deliver some closing remarks, feel free to jump in.
I'm going to defer to Dr. Van Dillen if he has anything else to say.
Thanks, Andrew. Well, I do. I just want to take a moment kind of reflecting on where we're at. I know this is our last scheduled press conference. Certainly we'll have more as the need arises, but it's hard to believe that we're 2 months into this, and it seems longer than that to some of us, I'm sure. And it's really been an overwhelming 2 months in a lot of ways. But I didn't want to sign off without taking the opportunity to just note the astounding way our community has stepped forward to support the healthcare system. So, I think of the mask drive and people like falling asleep sewing masks, donating over 5,000 masks, which help keep us and our community safe. Local businesses have quickly adapted their production lines and have worked with us to develop new forms of PPE, just incredible products. So I'll never be able to remember all of them, but I think of the work of Frost River and Duluth Pack and Cirrus. People have generously donated to our COVID-19 response fund. We've had hundreds of food drops and meals from community groups and local businesses, and just so many caring individuals who are concerned about our frontline workers. We've had donations of iPads and tablets to help our patients have the important visits that we had to restrict for safety. And then the encouragement and support through flyovers and chalk drawings and artwork and the parade from our fire department and police department and EMS, and even just the kind words that people give us when they see the St. Luke's jacket that we wear. All these demonstrations and more help sustain the energy and effort that's been required to manage through this. In Minnesota, we're proud to be the land of the 10,000 lakes and now the 10,000 masks. So just in closing, I wanted to say thank you to our community. There's nothing more powerful than the human spirit when we support one another. So thank you very much.
I'll echo that. I feel like the community has been incredibly supportive. Again, just as mentioned, the police and fire department, the flyovers and the masks, and just the kind words and the kind written words and spoken words and emails. And so thank you. We're in a partnership together with you. So I'm very grateful. Amy, I know you in the county health department, you have a huge role to help us get upstream to this and preventing spread in some of the areas of congregate living. And so thank you for all the work you guys do, and know that we think and work with you every day. And I'm very appreciative of all you have to do, and thank you. I'm so lucky with Dr. Prabhu, I have to say, he's like the ever-ready bunny. He goes 24/7. He's been a great colleague on this. And I'm telling you, there's times at night, early in the morning, weekends that I call him and he is always there. And he's been a great colleague. And finally, I would like to thank Dr. Thompson, Dr. Van Dillen. You know, we have started, St. Luke's and Essentia started collaborating before COVID-19. There's been new leadership and a sense that the community is going to benefit more by collaboration than competition. And if you compete, let's make it a friendly competition. And so there's a lot of different things non-COVID that we're working on together. I want the community to know this. And I think that COVID-19 has only enhanced our ability to think about collaboration and teamwork and stuff. So I'm very grateful to have partner down the street in Dr. Van Dillen and Thompson and St. Luke's as a whole. So I feel like that's important for the community to know. So thank you.
Yeah, Dr. Prabhu, I guess one comment gets that the Minnesota Department of Health and all the public health departments, Amy, St. Louis County, everyone, they've been such an invaluable resource to us. I mean, we're just on the phone with someone, either of those two, almost every day. And it's just amazing. They've expanded their hours. They're very accessible, email, phone, and we couldn't do it without public health.
Well, thanks. I also want to thank the healthcare systems. I feel like we really haven't ever worked as closely with the healthcare systems as we have in this planning and response, and it's really valuable. And a lot of different community partners. And there's been a lot of sacrifice. We've asked a lot of our community to sacrifice in terms of graduation, a lot of gatherings that, you know, for this time of year. There's been a lot that we've asked of people for prevention and control and protecting each other and our communities. So that is, it's been really challenging, and it will continue to be challenging, like everybody said here, we are not out of this situation, and we won't be for quite some time. So we do have to think differently now. We have to act differently now, and it's all in the name of protecting each other and our community. So I think that we can continue to do a really good job, and we'll continue the partnerships. It takes everybody. So I really appreciate all the sacrifices people have made and all the partnerships that have been built. And I think we're well positioned to handle as a community what comes down the road.
Thank you, Dr. Pryor and Dr. Van Dillen and Amy. We do have, I think we'll end it here. We do have one last question, and so I want to get to that, and then I think we'll wrap it up after that. The question comes from Renee with WDIO, and she says, more cases in children are popping up elsewhere. Are your folks prepared for that?
I mean, Dr. Pryor, I can comment on that. So I think she may be referring to these sort of what they call a Kawasaki's disease type illness in kids. And that's kind of a inflammation type illness that is known to occur in kids, particularly I believe under the age of 5 or so. And there is well set treatments for those. So hopefully there's not many of them. It's still a rare condition, but it does have seasonality regarding sort of viral infections. And this is just another viral infection that appears to be correlated with that type of illness.
Yeah, Andrew Thompson, I would agree with what Dr. Prabhu said, and also note that, though there is more disease being reported of this syndrome, it still remains very rare. You know, if New York State has 100 cases that they're aware of, they've had, I'm sure, many tens of thousands of kids who have actually been infected. So this, we're certainly aware and keeping an eye on it, but it is a rare complication.
I think many of our, pediatric specialists, the hospitalists, the cardiologists, they have experienced seeing this type of illness too.
All right. Well, with that, I think we're out of questions, and I think we're out of time. So thank you to the presenters, and thank you to our media folks for joining in. And until, again, the last time we'll meet here on a scheduled basis, but when news warrants, we can certainly get back together and answer your questions. So thank you, everybody.